Hello and welcome back to the Advancing Healthcare Innovation Show. I am your host, Michael Stamatinos. And if you're new to us, welcome. We are so excited to have you here because we are having just some really incredible conversations with amazing leaders that are painstakingly reshaping the future of healthcare. And we're pretty passionate about a few different areas. We're passionate about access, we're passionate about leadership and innovation adoption. And if you haven't had the opportunity to kind of tune in, if this is your first time tuning in, let me just sort of take a very quick step back and give you a little bit more on what we're trying to get done here. So, the ethos of the show is talking to real leaders, bringing real stories of innovation and leadership to life, not stuff that you're just sort of reading headlines, but real people that are in the trenches getting great work done and sharing little wins, as well as sharing some of those learnings. Because as you know, when you're innovating, you're not always winning all the time. So we want to learn from those things and ultimately share those with our community. And those will inevitably be shared throughout the rest of the world. So if you haven't had an opportunity to check out any of the historical interviews, wherever you are, however you're consuming this, if you're watching this, if you're listening to this, please do me a solid, wherever you are, just hit the subscribe button now so that any of the new interviews come directly to you. So I'm actually super excited about this next guest because they were referred directly. Got pulled over. Funny story. I was at a Becker's conference and got pulled over by David. He's like, "Hey, you have to meet someone." So I'm super excited about this. But before I dig into that, I want to share a number with you for just a moment. And the number is 3 million. That's how many clinical roles um, are actually sitting empty right now in this country. And then I want to share with you another number. $1.7 trillion dollars. Not billion, trillion. A trillion is a billion billion is a trillion. That is the student loan debt carried by the people who actually want to fill those roles. So two numbers, two crises, and the thing that I think that makes it so hard, for me to solve is that I mean, they're like feeding each other. And the truth is that this debt, it shapes where clinicians choose to go to work. It shapes how long they stay. And health systems obviously are desperate to fill these seats. And they're just throwing money at the problem, sign-on bonuses, big checks that are being laid out. And the same people end up leaving. And then the same roles open back up. And it's just this perpetual vicious cycle. And healthcare has been paying people to join, and then they act surprised when they leave. So today's guest, grew up in a family of physicians. She watched staffing gaps, basically wear down care teams. She's attended Harvard Business School, and this is when she started sort of asking a different question. What if you committed to a clinician before they actually ever graduated? Like the way the military does with the ROTC. And she explained this to me when we met, and she'll dig into it more. But what if that financial support was tied to staying instead of just showing up? That question is what became the company Clasp, which is led by Tess Michaels, the founder and CEO. So her model is called loan linking hiring. It's beautiful. She's going to go into it, but it basically employers commit to clinicians before graduation, and then student loan repayment happens over time. That's tied to tenure. So they have incredible roster of customers. Her CV is just ridiculous. Forbes 30 under 30, you name it, it's there. And it is absolutely delightful to have her come onto the show to share her story. So, Tess, great to see you. Welcome to the show.
Thank you so much, Michael, and it is great to see you again.
Yeah, of course, of course. So I want to start somewhere different. You grew up in a family of physicians.
Yeah.
Take me back to what that felt like as a kiddo.
Yeah.
Not necessarily from a career lesson standpoint, but really, like, what was it like at the dinner table? Parents having to field phone calls in the middle of the night. Like, what did you absorb from that without
Well,
knowing you were absorbing it?
yeah. So, yeah, I've been, in and around healthcare my entire life, and it is. It's fun, it's special, it's different. Having so many clinicians in the family. I mean, family gatherings means if anyone gets injured, you're good to go. As a kid growing up, what it means is I had no excuse to try and skip school because I was feeling under the weather. And so, look, but it really taught me a lot. I will say as a side note, I mean, my mom had me when she was in residency, and she joked that back in the day, 24-hour shifts are a very real thing. And so, I definitely feel like from the womb onward, got to experience just how hard healthcare clinicians work in America and just how important the role is. And
Yeah.
I myself thought one day I would practice and was weeks away from taking my MCAT to go into the field and, took a right turn and instead ended up exactly where I am today. So.
Pretty fascinating because I know you did a few cool tours of duty. You're in finance, in the private equity space. Um, that obviously was essentially your trajectory, and you walked away from that to
Yeah.
to start a company. I guess who in your life thought that you were out of your mind?
How much time do we have? No, just tease it. But look, I mean, I really had the bug to build early on, and so I actually built my first business when I was 19. I was in college, and I took a leap of faith and said, "Hey, I really believe that companies can invest in their talent differently through all sorts of ways, especially investing through corporate social responsibility." Now, frankly, I learned a lot of what to do and what not to do during the first set of sharp learning curves. But the
Yeah,
most important lesson was, God, I got to spend every single waking moment getting as close as I possibly can to understanding how our end user moves and shakes, what makes them tick. And, so with my first go around, I spent so long just focused on product in a vacuum and not enough, really in the trenches.
yeah, yeah.
And, you know, um, as you mentioned, started my career in finance as a healthcare banker at Goldman and then worked in private equity. And I got to say, like, there are few careers you can start your life in that I think are better, almost like training grounds. It's like a total boot camp
It's a
experience,
total
right?
tour of duty, man.
Yeah. Yeah. Not only do you learn every shortcut that possibly exists on Excel, but you also, really get to just like have massive pattern recognition. You're like, what makes for a good business? Like, what are the signals that, just even number
Yeah,
wise, metrics wise, give you an inkling? But I think all of that really carried me into Clasp and helped make this business take off a lot more quickly. So.
that's that's super interesting when you talk about pattern recognition. Are there certain patterns that you were able to recognize, especially with this particular problem? Like, how did this problem surface for you? Um, was this obviously being a number of clinicians in your family? Was this something that was talked about? Like, did you guys talk about money and like student loans and debt? Like, what was that like?
Oh, totally. I mean, look, I founded Clasp as I was headed for grad school, and I was looking at the sticker price going, whew, like, is it worth it to go back to school? And what I realized
Yeah,
in that moment is there are some industries like business where you can consider is it worth it or not worth it. But in healthcare, it's not a choice. It's do you want the job or not? Because in order to do the job, you have to get through this training. You have to get licensed, and then after those prereqs, you can gain entry, right? And I hear about these stories all the time. I mean, my husband is a physician and he took out a significant amount of student debt. He grew up in a very small town and didn't have a lot of financial support. And
yeah,
he tells me all the time, he's like, look, the reality is you have to take a huge leap of faith as a student, a bet on yourself to say, I'm going to put in the time to enroll in school and get through school. I'm going to take out
yeah,
hundreds of thousands of dollars of student loan support, and then I'm going to hope and pray that a great job is waiting for me on the other end. And then I'm going to spend another decade or more of my life working to pay down all of those costs that I'd taken on. And so the order of operations is just completely out of whack, right? We have to
it's like this like
flip
bottom bell curve, and it's like, wait, we got to break that plan. But once we break the plan,
exactly.
it'll be all right. But it's like you got to go there
Totally.
pretty
You
deep.
got to flip that entire equation around and say, wait a second, why do we have millions of people that we are short in healthcare? It's
Yeah,
because it is so challenging to put the full onus on the individual and be like, hey, of course you should take this, bet on yourself. And so instead, if we can bring employers into the equation earlier, give individuals that commitment of not only a job, but hey, there's going to be an employer who sees you, who cares about you, who's going to help repay those loans. Suddenly, you've knocked out the two biggest uncertainties of someone's life at the very point that it matters most. And then the system can actually work, right? So,
Mm. Because
yeah.
most people they see a staffing problem. The workforce crisis is a staffing problem, but like I'm just amazed that you saw something different.
Yes.
What did it bother you that you saw something that other people couldn't see? And you're like, I see it clear as day. Like what don't you guys see here?
Yeah. So, look, I think, the reality is like the parties are just siloed, right? Like employers aren't always getting to talk to students as they're thinking about enrolling in school or when they're in school about what's stressing them out the most, right? They're thinking about what happens once they're employed and how do you keep them engaged and retained at that point. And from a school's perspective, they're doing as much as they can to help you with access to education and getting
Yeah,
into the job, but not necessarily how do I make sure that people who graduated from here are staying in the job. And so I think the view we had is there's three big parts of this equation, right?
yeah,
Part one is how do you think about the broad barriers to entry, which include the financial challenges that someone has to
yeah, yeah,
deal with. Second is the fact that there are real talent shortages. And so you got to help employers better recruit. And sometimes your local markets may not have enough density of talent. And so like you got to get creative with the how, which, we have all sorts of ways we do that. And then the last piece is okay, you got someone through school, you hired them, but in healthcare, turnover is just brutal. I mean, they show that for new grad nurses, 50% of them leave their first job in the first 2 years of employment. I mean, that
Eesh.
cycle is so painful. And that's exactly what we want
It's
to
like a revolving
target.
door. You spend all
Exactly.
this time and energy training
Yeah.
people up, and then it's like, all right, goodbye. See you later.
Yes.
And you got to do it all over again. It's a
Exactly.
terrible, terrible thing to do. So you see this, you see these dynamics, you recognize these patterns, you're considering B school. You're like, I'm going into B school, and then I'm starting this company. Like, take me through that. Did you have people that were trying to talk you out of it? People talking you into it? What
Yeah.
was the dynamic around you at the
Yeah.
time?
So, first of all, I did a lot of not just soul searching, but actually talking to all sorts of people from every walk of life to figure out is this pain point as real as I think it is? And so I was, spending time talking to students on campuses. I was talking to Uber drivers. I was talking to friends at bars. I was trying to figure out, like, hey, what's what's the real driver here? And honestly, for better or worse, this is a pretty universal pain point. I mean, for a lot of the clinical roles we support, like nurse anesthesia or physical therapists, upward of 90% of individuals
Yeah.
have student loans for these roles, right? So,
Yeah.
uh, so the reality was like, I was like, okay, this is a felt pain. Like students know it exists. Now on the employer side, what I have to know is do they need to hire this talent critically, urgently? Is it really important? Which, of course,
Hmm.
yes, that proved out. And second is, are the retention challenges as bad as what we sometimes hear? And is that universal, right? And that definitely played out. And so this really brought us to building, what you mentioned in the beginning, the ROTC model for healthcare.
Yeah.
And it's just been super fascinating seeing how it's completely changed how wide the clinical candidate pools are for healthcare
Hmm.
systems, which I can talk
Hmm.
through, and how low
Yeah.
turnover can really go. So,
Let's
yeah.
let's 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 dig in. I mean, it's your episode. Take it where you want to take it.
Yeah. So giving you a little bit of a flavor for how this works. So, as you mentioned, we work with healthcare systems all over the country. Our partners include groups like Boston Children's and Novant, Northwestern Medicine, Ohio Health. And we essentially help them meet hard to hire clinical talent like respiratory therapists, nurse anesthetists, rad techs,
Hmm.
nurses, etc., through some very creative channels. So we're plugged into universities all across the nation. So they're not just
Hmm.
limited to their local markets, but we also have, I mean, curated networks of TikTok influencers, which I know sounds funny, but these are clinicians who have, 100,000 plus followers.
Yes.
And
Yeah.
this generation loves it, right? So we build these national movements. We let these employers get exposure outside of just their traditional channels. And suddenly we have applicants from all over the country. So to date, Clasp has had applicants from 48 states in the country. And our average
Nice.
employer has had applicants from 10 plus states per location. So a lot of widening there. So that's part one.
Yeah. It's super. You know what's amazing to me? First off, those stats are tremendous, and obviously the logos, those are sort of first
Yeah.
movers. I just feel like historically healthcare has been very focused on, well, let's just give a sign-on bonus. And I see this a lot. It's like, hey, 10 to 20K sign-on bonus for like a therapist. And look, smart people design them and they keep funding them. But here's the thing, like, why do smart people keep betting on something that like clearly is not working?
Yes.
It's
Yes.
not working.
I couldn't agree more. I mean, if anything, the sign-on bonus has completely killed the incentive for retention in healthcare, right? People jump
Yeah.
ship from
Yeah.
healthcare system to healthcare system. And I recently did a talk all about the concept of like, we got to stop paying nurses to leave because the reality is this is
Yes.
exactly what it's doing, is it's not enforcing people wanting to drive teamwork. It's or saying, frankly, turnover because it's saying, hey, I'm going to chase the next shiny dollar. And by the way, starting this year, a number of states have started to eliminate the ability to do clawbacks. So the one retention hook that hospitals had for doing a sign-on bonus is now getting taken away from it as well. And
Mhm.
so, yeah, so we got to find an alternative. And that's where we come in. We say, okay, let's reallocate the dollars you're using to sign-on bonuses and let's reallocate the dollars you're using for all of that unnecessary attrition via contract labor towards student loan repayment. And if we do that, then every single penny of yours is tied to retention. It's paid on a monthly basis only once someone starts employment. And not only have you now found more clinicians, but we can
Right.
gamify it. Like we can literally make them feel more loyal to you. And if we do that
Gamify it?
well, yes. So, yeah, I mean, look, half of the battle is psychology with life.
Yeah.
I always joke with my team, I'm like, people have short-term memories. So odds are that if you paid them a sign-on bonus, they forgot
Hmm.
about it real fast after. In our
Totally.
model, we, you know, are helping employers design their student loan repayment programs. It doesn't have to be 100% of the loan
Right.
someone's taken out.
Right.
So we first design it based on their needs, figuring out what units or shifts or locations or roles should we
Yeah.
offer it to. And then once someone is employed, every single month, we're sending them a bill and we're saying, this is what you would
Hmm.
have owed had your employer not had your back. It would have
Hmm.
taken you 10 years to pay this down. Now it's taking you 3 years. We gamify that with thermometers. We give them financial wellness tools like budgeting
Mm.
tools that say, hint, hint, you got more in your budget now. We collect video testimonials. So over and over again, you're almost like
Yeah.
psychologically nudging people toward that loyalty.
Mm. Do you have any stories of folks that have, come in with a certain amount of debt and have gone debt free? Ones that you're able to like publicly
Yeah.
share? Just like
Yeah.
make it make it concrete for me so that if it's a nurse or a doctor, I just would love to. I'd love to hear
Yes.
one.
So, yeah, many of these stories I always tell our team, it doesn't matter how many individuals we support. Even if there's thousands of individuals, it's always they're never a number, it's always a person. And we
Yeah.
collect a lot of these stories. So I have a couple that I could share. So first, there's this individual, Matthew, who was one of the first students that we supported. And I remember from the early days there, I had heard stories about how he kept delaying school. He was a optician, so wanted to
Okay.
become an optometrist, but he just could not take the bet there. He was like, "Look, costs a lot. I don't know if I can just jump ship, right?
Okay.
And leave a paying job to go to school full time and not
Yeah.
earn when I have all of these things I need to do for my life. And so what we ended up doing is showing him employers that were willing to help repay 2 years of his education over the first few years of his employment. And he, first of all, powered through school, highly motivated,
Yeah.
um, ended up being able to join private practice, which was not a career path he thought was possible before this,
Okay.
because you usually need to be in a better financial position to take
Right.
that
Right.
change. He started his career there. He was able to then grow his family. And I remember during his video testimonial, he had just had a young baby girl who
Nice.
he, kind of shared, like, I got to start my life earlier. I got to join my dream career, and I now have all of this financial support. And look, I mean, we've got employers all over the country, but we have some employers, for example, for nurse anesthesia that are supporting $180,000 of student loan support per person. I mean, that's totally life-changing, right? And so,
Yeah. Yeah.
yeah.
So, I mean, I think I read a stat somewhere it was like $130 million in employer commitments. How do you
Yes.
how do you how do you get a CFO uh, at a major health system to write a check before a clinician is even graduated? Like,
Yeah. So let me be
what's
very
that
clear.
sales conversation?
Yeah. So let me be very, very clear. They are not writing the check before the individual has graduated. What we're doing is we're saying, hey, you are going to get an early commitment around hiring this individual while they're in school. We're going to help them get access to federal student loans, private student loans like Sally Mae or SoFi, or by the
Okay.
way, if they can't get funding for school. We at Clasp have raised $75 million of impact capital, and we can help fund their
Mm,
education. So we're going to make sure that person graduates school and gets through the program. But that individual is going to have a signed commitment that says once you graduate, pass your licensure exams, and start employment, over the first, call it 3 years of your career, the employer is going to pay down
wow.
a portion of your student loans. So, from a CFO's perspective, they think, wait a second, I just eliminated my sign-on bonuses. I reduced my locum or traveler or contract labor spend. I reduced my overall turnover, and I'm now paying towards student loan repayment, but a portion of those dollars are tax advantaged. So you've
Mm,
checked all the boxes of I'm not actually spending more dollars, I'm saving or repurposing dollars, but the individual is getting a lot more than they were receiving before. So it's
yeah.
finally funneled to the individual that matters the most for the workforce, which is that stable full-time employee.
I mean, the hospital is actually earning, especially if it's a physician or
Yes.
a mid-level, because they're if they're billing with RVUs and whatnot. I mean, they are generating income
100%. I
revenue.
mean, I'll give you an example. So, as I mentioned, my husband's a surgeon, and he recently lost, a nurse anesthetist that worked with them. And he told me, he's like, look, surprise losses are scary because if they don't have backup plans in place, what happens,
Mhm.
right? Surgeries get canceled, patients get
Yeah,
delayed, and physicians obviously get impacted from a productivity perspective. But the most important, again, is the patient side. And that is
yeah,
just a tough pill to swallow for the whole system. And that's exactly how we think about it. Like healthcare is not just about nurses or just about doctors. It's like you got to have your surge techs and your rad techs and your nurse anesthetists all in place to make the machine run, right?
yeah. That's brilliant. Who was the first health system that trusted you enough to kind of run through this, and like what did that conversation look like?
Yeah. So interestingly, our very first partner, even before we brought healthcare systems in place, was Warby Parker. And they said, hey,
Oh,
you've
interesting.
got students and you've got dollars and we've got jobs and we've got a way to repay those dollars. What do you think? So I met with their C-suite, and it was so special. This was years ago. We ended up seeing the program go gangbusters. They had 3x the number of optometrists apply
Wow.
versus seats they had available. And on top of that, we ended up seeing like, many of their large peers immediately, followed suit. And we had, again, not only just 3x the number of optometrists, but we placed them in 10 different states, and the program continued to grow year after year. And we thought in that moment, wow, hold on. This is so interesting in the subsector, but
Yeah.
let's look at the broader landscape of healthcare. And then we started partnering with large healthcare systems like the ones I mentioned, Boston
Yeah.
Children's and Novant and Northwestern. And in that moment, we realized that this model is such a great fit for healthcare generally. Um, and so last year, we 4x'd the number of healthcare employers that we supported. And then this year, we
Well
just
done.
raised funding to step on the gas for that. So,
That's
yeah.
because you've been at this for a while. I think when we spoke, you were like, you've been at it for like 8 years. I
Yes,
mean,
yes.
it's quite a, it's quite a run.
Yeah. I mean, it is just like one of those things where you realize that The the fact is most good things in life are the long game. This is definitely the long game. And I joke that
100%.
startup years are like dog years. Every year feels like 7 years. But uh, but I gotta say, this has like been the most special work to be doing. And so you know,
Ah,
pretty jazzed about
man.
it. Yeah.
I'm tempted. I want to ask you something. Maybe you've never been asked it before
Yeah.
in an interview.
Please surprise me.
I don't know. When was the hardest week you had building this company?
Yeah.
Because you've been outwardly, I mean, it just seems like one can read headlines and press releases like, dude, everything's great. Everything's great. But deep down, I mean, been around enough founders to know that it's not always great. I'm just
Yeah.
curious, what was the hardest week you've
Yeah.
had building this company?
Yeah. First of all, it's it is a roller coaster, period, full stop, right? So I think there's a number of moments where you look back and you're like, wow, we got through that, right? Which at the time felt nutty and wild. And I always tell my team, I'm like, part of the fun of being in a startup is there's a lot of ambiguity. And part of the challenge of being in a startup, right, is that there's a lot of ambiguity. But I would say, the reality is on the customer side of the house, we've been very fortunate, right? We have not had partners churn. We have had a lot of partners, as I mentioned, as recently as this week, who have expanded their partnerships with us. And that gives me a lot of, joy. But I'd say the areas that have been most challenging are one, just the people side, right? Like you grow so close and
Hmm.
with every single team member. And I'm very fortunate that our executive
Hmm.
team, a lot of them have been with me for many years, right? My COO has been with me
Yeah.
for 6 years. My CTO has been with me for 5 years. Our operations lead for 5 years, etc. But there are chapters in a startup, right? Folks who were amazing from
Yeah.
1 to 10, folks who were great from 10 to 50, from 50 to 100. And there are hard weeks. I'm not going to say it's just one week, hard moments where that is probably the area where you know that you have a lot to do and a lot to build toward, but like there's still just the heartbeat that comes with, like who
Yeah.
helped you get there versus
Yeah.
who you need going forward. And those have
Yeah.
been some of the toughest calls, but the most necessary parts of the equation, hands down, for sure. And outside of that, I would say like the rest of it just feels like it is normal territory. It is like part of the motion, right? You roll with the punches, you keep going. But
Yeah. Yeah. What I remember is when we first connected, I think we had both realized that both of our parents are immigrants.
hmm
And I would suspect that, education is a big part of the reason why you're able to kind of they were able to build a life here. And I know you've said that kind of publicly. But I guess what does it feel like to build a company that's
Yeah.
about educational funding while also kind of carrying that story? Does it feel personal for you every day, or has it has it
Yeah.
become something else?
Yeah. Look, from two vantage points, I'd say like with my broader family, with my parents, etc. It's special because it's always been told to me there is nothing more important than education. It was the one area that my parents always invested in the most with us growing
Yeah.
up.
Yeah.
And, like every car ride was like going through Brainiac flashcards and, like asking me random math multiplications on the spot. And, like I had totally nerdy parents. I'm a nerd too. It is what it is. But, I
Hey,
think
all good.
but I think, that was always being to me. And I got to see my parents who, when they immigrated here, both continued to go for more advanced degrees while they were in the States. And that takes a lot because you can't get access to federal loans, easily as a immigrant in the US, right? And so I think, I had already heard about what they had to give up to get there. And then coming into a household where I have a spouse who every day, I mean, you think about largest bills in life for most Americans, and, including our household, those rent and your student loan payments, right? And
Yeah.
like
Yeah.
paying four figures every single month makes you really think about it. Um, and so I think that, lens has really helped me craft my why every day, where I'm like, God, there's no sector that I think, you know, uh, not only needs this more, but that like gives me
Yeah.
more joy to be a part of. And there's no problem within the sector that I'm like, if not us, then who? I tell my team that all the time, and I really believe it, right? So,
Yeah.
yeah,
What I just sort of realized is I don't even want to call it infrastructure. It's not. It's more like this is an ecosystem. It's a living, breathing thing that you're building for a generation of clinicians. So, and my hope is that many of them will hear this conversation. What do you what do you want to say to them directly? To the 23-year-old nurse who's, sitting in his or her apartment with,
yeah,
90 grand
yeah,
in debt and has got a shift at, 6 in the morning.
yeah. So much of what Clasp has been built around is helping individuals feel more seen. I think that healthcare has become more transactional because of the
Yeah.
urgency with every hire. That's why the main
Hmm.
tools are things like sign-on bonuses. It doesn't show care or long-term investment. It's, hey, I really need talent today. And when I think about Clasp, it's like Clasp is in your corner. And when I say that, what it means is it's hard to go out to bat for yourself and be like, hey,
Hmm.
I want to get up really early. I want to be able to work this long shift. I
Yeah.
want to serve my patients right, but I don't want to come home stressed and have to, count
Yeah.
every penny for the next big bill that I have to pay. And
Right.
so if we can use our platform to go and look at all the wasted dollars that are
Hmm.
being thrown into the wrong directions and the wrong places and the wrong pockets and reallocate that to the right place,
Yeah.
which is to the actual clinician who is helping that patient on a day-to-day basis, who
Right.
is our long-term workforce, like that's real impact.
Hmm.
And
Hmm.
I just want, any clinician to know that, yeah, it is a really tough job. I have so much respect for it. And while, I can't practice the ways that we can help her, saying,
Yeah.
what else can we take off your plate while you keep your plate pretty full, right? So,
Yeah.
yeah.
Before I forget, where can people go to follow your journey, your team's journey?
Yeah.
Give us like a commercial so that we can, pump this out.
Yeah, absolutely. So please come check out Clasp, CLASP.com. Go to our website, take a peek around if you're a healthcare system or healthcare employer, or a student or even a current practicing clinician who's like, I need some support with my student loans. And if you have any questions for me directly, you can send me an email. It's just Tess, at clasp.com. But I would love to hear from you, love to hear what else we're missing or should be thinking
Yeah.
about, and we can go from there.
You've been great, Tess. I think that not I think, no, I know you are like wise beyond your years. I just feel like you're like an old soul. And I say that in like the nicest, kindest possible way. So just thank you for sharing a bit of your journey. And obviously you're in a newer chapter and there's going to be other chapters. And
Yeah,
my hope is that you continue to grow and drive impact and continue to just sharing your why with your team as they continue to grow. So that's incredible. And for those of you if you've been listening to this and you found it to be particularly enlightening, entertaining, my encouragement to you is would you mind sharing it? Would you mind sharing it with someone or commenting on it, letting us know what resonated with you? That's always helpful. That gives us a little bit of a signal. So just remember, this is not just a content machine. This is a community. It's a living, breathing thing. So if there is a topic that you would like for us to explore, or maybe there's a leader that you want to have come on to the show, yeah, drop us a note. We do read them. So thank you for listening, Tess. So good to see you again. Keep building with purpose, and we will see you next time on the Advancing Healthcare Innovation Show.